Collective immunity, a dangerous mirage, warn many scientists. Paris, sometimes presented as a cause for hope in the early days of the COVID-19 pandemic and a way to avoid widespread lockdowns, the idea of letting the virus circulate to achieve collective immunity is emerging more and more clearly as a dangerous mirage, explain many scientists. The idea is that once a certain proportion of the population has been affected, the epidemic would stop on its own, for lack of victims to strike. But after months of pandemic, we are very, very far from the account, notes to AFP Frédéric Altare, specialist in immunity at Inserm. The World Health Organization, WHO, declared it bluntly on Monday, never, in the history of public health, has collective immunity been used as a strategy to respond to an epidemic, let alone a pandemic. It is scientifically and ethically problematic, said its managing director, Tedros Adhanom Ghebreyesus. It is simply unethical to unleash a dangerous virus, which we do not understand everything about. This is not an option, he insisted, recalling that around 10% of the population could have been infected with the virus in most countries. Dangerous calculation. Billions of people therefore remain in theory at the mercy of a virus more dangerous, more lethal and more contagious than the seasonal flu. And for which there is no vaccine. In May, the WHO warned that countries relying on collective immunity were engaging in a really dangerous calculation. Regularly, and even very recently, U.S. President Donald Trump has defended this idea. In early October, scientists defended it in a call, the Great Barrington Declaration, to let the virus circulate in young and healthy populations while protecting the most vulnerable. A call supported, according to the American press, by the White House. For its defenders, the main benefit of this strategy would be to avoid economic, social and health damage, generalized confinements even though some countries, such as Spain, have had to reintroduce local confinement measures, or such as the France curfew. This is a mistake, responded Thursday 80 scientists in an open letter published by the medical journal The Lancet. Uncontrolled transmission among the youngest would run significant risks in terms of health and mortality for the entire population, they note, also noting the risk of saturation of health systems. Thresholds. Sweden, which has refused to confine its population and close schools, bars and restaurants, now seems to be caught up in the pandemic. Compared to its population, COVID mortality is among the 15 highest in the world, according to data from Johns Hopkins University. Another problem, it is not known how long the immunity against COVID lasts and cases of reinfections, although very rare, have been reported. It is possible that the antibodies weaken over time, said WHO official Maria van Kerkhove last week. Reinfections show us that we cannot rely on the immunity acquired through natural infection to achieve group immunity, wrote Professor Akiko Iwasaki, immunity specialist at Yale University, States United. Some supporters of natural herd immunity also argue that its threshold, usually estimated at around 60 to 70%, is in fact lower, in particular because not everyone is equally susceptible to catching the virus, between country people and city dwellers for example or young and old. What we have also discovered over time is that some people are protected from SARS-CoV-2 even though they have not encountered it, explains Frédéric Altare, Inserm. Rather than antibodies, those that we are looking for with serological tests, specifically directed against this virus, they have developed another immunity, called cellular, thanks to a certain type of white blood cell. No doubt because they have already encountered infectious agents resembling SARS-CoV-2, these blood cells identify it as a danger and attack it, he says. This means that the figures announced, 5 to 10% possible immunity, are probably a little underestimated but we do not know to what extent, notes Frédéric Altare. But even by pushing the statistics, taking into account, this, other immunity, the fact that people do not all get infected the same, that elderly populations are less likely to become infected because they protect themselves more, we managed to bring the percentages down to 50%, not below, he said. While noting that reaching this threshold would result in a considerable number of deaths. Collective immunity must therefore go through safe and effective vaccines, says Professor Iwasaki.